Zika virus is a viral illness primarily transmitted by Aedes mosquitoes, particularly Aedes aegypti and Aedes albopictus, which are the same mosquitoes that spread diseases like dengue, chikungunya, and yellow fever. The virus is zoonotic, meaning it can be transmitted between humans and other species, although humans are the main reservoir. Zika virus is notable because it can be transmitted from pregnant women to their fetuses, leading to serious birth defects. Causes and transmission. Zika virus is primarily transmitted through the bite of an infected Aedes mosquito. The mosquitoes become infected by biting the person already infected with the virus. Other methods of transmission include sexual transmission. Zika can be passed from an infected person to their sexual partner. Mother-to-child transmission. The pregnant woman who contracts Zika can't transmit the virus to her unborn child, which can result in birth defects. Blood transfusion. Although rare, there have been cases of Zika virus transmission via contaminated blood products. Laboratory exposure. In rare cases, the virus can be transmitted through exposure in a laboratory setting. Symptoms. Zika virus infection is often mild or asymptomatic, but when symptoms do occur, they are typically mild and last for a few days to a week. The most common symptoms include fever, rash, often maculopapular, starting on the face and spreading to the rest of the body, joint pain particularly in the small joints, like the fingers and toes, conjunctivitis, red eyes, muscle pain, headache, fatigue or malaise. Most people infected with Zika virus have mild symptoms and recover without needing significant medical treatment. Severe symptoms and complications are rare, but the virus can lead to more serious conditions in certain individuals. Complications, microcephaly and other birth defects. The most concerning complication of Zika virus infection is its effect on pregnancy. When a pregnant woman is infected with Zika, the virus can cause severe birth defects, particularly microcephaly, where the baby is born with an abnormally small head and brain. Other birth defects include eye defects, hearing loss, and joint deformities. Guillain-Barré syndrome (GBS). Zika infection has been linked to an increased risk of Guillain-Barré syndrome, the rare but serious condition where the immune system attacks the peripheral nervous system, causing muscle weakness and sometimes paralysis. Diagnosis. Zika virus is diagnosed based on a combination of clinical symptoms, travel history especially to areas where Zika is endemic, and laboratory testing. Diagnostic tests include PCR polymerase chain reaction, a molecular test that detects the virus's genetic material in blood, urine, or saliva. Serology antibody testing, blood tests to detect antibodies against Zika virus. This may help confirm past infections. Urine tests. The virus can also be detected in urine, and it can persist in urine for longer time than in blood. Treatment. There is no specific antiviral treatment for Zika virus. Treatment focuses on relieving symptoms. Rest, hydration, pain relievers, such as acetaminophen, paracetamol to reduce fever and ease pain. Non-steroidal anti-inflammatory drugs and SAIDs such as ibuprofen should be avoided, especially if there is any suspicion of dengue, since they can increase the risk of bleeding. Antihistamines for the rash and itching. Pregnant women with suspected Zika infection should seek immediate medical advice, as the virus can have serious effects on the unborn child. Prevention. There is no vaccine for Zika virus, so prevention primarily focuses on avoiding mosquito bites and preventing mosquito breeding. Strategies include use of insect repellent. Choose repellents that contain DEET, picaridin, or oil of lemon eucalyptus. Wear protective clothing, long-sleeve shirts, long pants, socks, and shoes to prevent mosquito bites. Mosquito nets and screens. Use mosquito nets especially when sleeping, or ensure that windows and doors are properly screened. Avoid peak mosquito activity. Aedes mosquitoes are most active during the early morning and late afternoon, so extra precautions should be taken during these times. Eliminate mosquito breeding sites. Empty, cover, or dispose of containers that collect water, as standing water is where mosquitoes lay their eggs. Condom use. To prevent sexual transmission, condoms should be used during sexual activity, especially in areas with ongoing Zika virus transmission or if the partner has traveled to affected regions. Risk areas. Zika virus is found in tropical and subtropical regions around the world, particularly in parts of Latin America, South and Southeast Asia, and Africa. However, outbreaks have also occurred in more developed regions, including the United States, particularly in Florida and Texas and Pacific Islands. The virus has spread to new areas as mosquitoes expand their range. Travel considerations. Travelers to regions with active Zika transmission should take steps to avoid mosquito bites and consider delaying pregnancy for a period of time if they have been exposed to Zika. The Centers for Disease Control and Prevention (CDC) and the World Health Organization who provide up-to-date travel advisories for areas with Zika outbreaks. Conclusion. Zika virus is a mosquito-borne illness with mild symptoms for most people but can cause serious complications, especially for pregnant women and their babies. The risk of birth defects from Zika is significant, and the virus has also been linked to Guillain-Barré syndrome in adults. As there is no specific vaccine or treatment, prevention is crucial, particularly through mosquito control measures and safe sexual practices. Public health agencies like the CDC and WHO continue to monitor outbreaks and provide travel guidelines to reduce the risk of Zika transmission.